There's nothing like a good night's sleep. You awake and feel refreshed and ready for the day. But for millions, the night is spent snoring and tossing and turning and gasping for breath. It's a condition known as sleep apnea, and it can cause depression, acid reflux disease, increased risk of heart disease. We sat down recently with Dr. Magnus Wilson to talk about the enormity of this sleep condition. Sleep disorders are a significant health issue in the United States. One of the most common disorders is sleep apnea. It's estimated that 22 million Americans suffer from it, and 80% of those cases go undiagnosed. Dr. Magnus Wilson is a dentist with more than 30 years of experience. He belongs to the Cambride Dental Group, a consortium of multi-specialists who serve clients with a variety of needs. One of their disciplines is the testing and the treatment of sleep apnea through the use of oral appliances. Dr. Wilson has sleep apnea himself, so he's personally familiar with having the disorder and the methods of treating it. We talked to him to learn more.
During sleep, the muscles of the neck, tongue, and upper airway relax, resulting in partial closure, which is snoring, or total closure, which is apnea, or absence of breathing. What happens is when breathing ceases, it can stop for 10, 20, 60 seconds or more, and it results in the stoppage of flow of life-giving oxygen to the brain tissues. This causes a slight arousal to the patient in sleep. They don't even remember it, but it results in the disturbance of the sleep pattern. Therefore, they wake up tired or sleepy the next day. Well, there are a lot of diseases associated with sleep apnea, most commonly high blood pressure. We also see a lot of patients with acid reflux. They have difficulty controlling type 2 diabetes. They have morning headaches, excessive sleepiness during the day, resulting in poor performance or dangerous driving, restless sleep, disturbance of the sleep pattern for the sleep partner. Depression is more and more commonly found with sleep apnea now, as is stroke risk, atrial fibrillation, memory loss, sexual dysfunction. Also, there's an increased risk of sudden death.
Dr. Wilson is a sleep apnea sufferer himself with over 20 years' experience having the disease. He has a passion for helping alleviate the condition for his clients. Here, Dr. Wilson explains the evaluation process of a sleep study and how the course of treatment is determined.
When someone shows the signs or symptoms of sleep apnea, we arrange a home sleep test for them. We will then get the sleep test graded to determine the severity of the sleep apnea. We partner with our physicians and sleep specialists to determine the best course of treatment for our patients. Once the patient's sleep study is graded to determine the level of apnea, we'll choose the appropriate direction for treatment. There are several treatment options. For mild and moderate, first-line treatment today is dictated by the standard of care is a modern custom-fit oral appliance, which moves the jaw forward to open the airway during sleep. For patients that have severe apnea, first-line treatment is still the CPAP, which is a machine that blows air down the throat. But unfortunately, we find that up to 50% of the population can't wear their CPAP or can't wear it enough hours to be effective, and that's of great concern to us. Many of those patients will then turn as an alternative to an oral appliance, which is acceptance rate is closer to 80% by current estimates.
One of Dr. Wilson's goals is to get the word out about alternatives for the patients who can't use a CPAP machine.
It's very important for us to develop relationships with our physicians in the community, because what we want to do is spread the word about the alternatives to their patients that cannot wear a CPAP. There are many, many patients, as we talked about earlier, that cannot wear a CPAP, so we want to be able to offer our colleagues options for them.
Jennifer Carter has been working with Dr. Wilson as a dental assistant for over 10 years. We talked to her about her role and experience in administering home sleep tests.
Well, I'm Dr. Wilson's direct assistant, so every patient that he sees and treats comes in contact with me. I administer every home sleep test, I help him with his consultations, I help him with the treatment of every sleep apnea patient. The home sleep tests are great because many patients don't want to go to a sleep center, stay the night. Oftentimes they have to stay 2 nights at the lab. So the home sleep tests are convenient. They're easy to perform. They can do them in the privacy of their own home, so patients really love that. The home sleep test monitors many of the things that a lab sleep test monitors: airflow, oxygen saturation, pulse, thorax and abdominal effort, snoring. It records your snoring. It even records your body position. Well, every home sleep test that we perform is sent and submitted to a board-certified sleep physician who actually grades the study and performs the diagnosis. They then send us back a sleep study report, which we go over with the patient.
Frank Perkins is one of the many patients helped by Cambride Dental Group. He had tried numerous therapies without success. His sleep apnea had progressed to the point where he lost numerous jobs from falling asleep. Frank tells his story.
My sleep apnea, when I came to Cambride Dental Group, was so severe that I had no regular sleep schedule. I lost job after job, falling over, slumped in my chair, was not getting regular sleep. I wasn't breathing correctly. I had pretty much lost all hope and sanity.
But there was hope, Frank explains.
The treatment came when a friend suggested that I see a sleep therapy doctor, and I visited one in West Bloomfield that was recommended to me. And she eventually, we tried the CPAP machine, which didn't work out for me. And then eventually she referred me to Dr. Wilson, who's very friendly staff, very clean office, very professional. And we discussed, getting a dental appliance made, which as soon as it was fitted, I put it in at night thinking, well, here's another try. But within a week, I had come onto a regular sleep schedule. I hadn't noticed any more bruises. I was happier. My mood went from just being very dark to being just happy and peaceful. And I was able to cope with things I couldn't cope with before that once upon a time I could cope with. And I guess I owe it all to Dr. Wilson.
Cammie Rudolph is a retired registered nurse with over 30 years of experience in her field. Today, she works as an administrator for the Cambride Dental Group. She works one-on-one with patients to discuss their treatment plans and insurance programs. With her medical background and experience, she sees firsthand what sleep apnea can do to her patients.
A lot of sleep apnea patients come in and their expression is pretty flat. They don't seem happy, they don't smile a lot. A lot of them report that they're on depression medication. There's a huge population of patients with sleep apnea that also have depression, which makes sense to me because how do you feel when you haven't had a good night's sleep for one day, let alone every day of your life?
One of the rewards of working in the field is seeing the changes in patients. Cammie is proud of the work they do and tells us about the changes that she sees.
When the patients come back several months later after starting the sleep apnea therapy, it's extremely gratifying. They come back, they look so much better. The dark circles under their eyes are gone. They're more typically smiling and joking. Their skin is glowing. They just look so much better. And you sit there and you're thinking, is that the same person? But they feel good. The chronic, I just don't feel like myself feeling is gone, and you really see their personality.
As with any medical treatment, how it will be paid for is a concern. Cammie clarifies how insurance pays for sleep apnea therapy.
Many times a lot of people don't seek help for sleep apnea because they think it's going to cost them a lot of money. Dental insurance does not cover sleep apnea. It's a medical procedure. That's why we have to follow all of the medical requirements to treat these patients. But what they really don't know is that medical insurance typically covers the sleep apnea treatment.
Larry Lobert has had sleep apnea for over 10 years. He told us about his experience being a patient with the Cambride Dental Group.
Bring a mini sleep study, and so rather than going through the big sleep study at the hospital, a home kit to do a measurement of your apnea, it's very convenient, and the customer service exceptional. They seem to be really concerned about doing it right.
So, what effect has the oral appliance had on the quality of life for Larry?
Oh, it's outstanding. You spring out of bed in the morning, you feel rested, you feel like you haven't been beaten up during the night. It's terrific.
Ken Clarkson has been affected by sleep apnea. He spoke on how the condition has impacted his life.
Sleep apnea affected my life by interfering with my personal relationships because I snored so loudly that it was impossible to sleep with anyone. It also affected my life by me being tired all the time. I thought that I was some sort of a guru or sleep master because I could fall asleep at any time, anywhere.
Ken has noticed a difference in the way he feels since he's received his oral appliance. He has recommendations about what to do if you suspect that you or someone you know may have sleep apnea.
I've had much better sleep. I don't get up as often. There are nights when I'll sleep the entire night through. And that would never happen before. Also, there are times when I'll wake up before my alarm goes off, feeling rested and actually wanting to get out of bed, which has been unheard of for me. So I would recommend that if someone is living with someone who's complaining about your snoring, if you're feeling tired, that you come in and visit with the people and check it out. The sleep study that they do in your home is not so obtrusive that it should constitute a barrier to entry anymore, in my mind. It's definitely worth the effort. So,
Sleep apnea is a serious condition, and it's now treatable, and it's covered by your health insurance.